Okay, we're going to begin with a review of the skull. We'll first of all have the frontal bone, which is the bone of the forehead. The features of the frontal bone you're responsible for are the glabella, or monobrow, and the supraorbital foramens, or notches, which are the small divots you can see above the orbits. Behind the frontal bone, we have the paired parietal bones, which are located on the upper sides of the skull. The parietal bones are connected via the sagittal suture, and the parietal bones connect to the frontal bone via the coronal or frontal suture. Either name is appropriate. As we go to the side of the cranium, we encounter the temporal bone, of which we can see here and portions of down here. The side of the temporal bone, on the side of the skull, is the squamous region. The squamous region of the temporal bone connects to the parietal bone via the squamous suture. Projecting off of the temporal bone, we can see this small bit of zygomatic process, which extends from the temporal bone to where this yellow or orangish line is. As we look further back on the temporal bone, we can see the ear hole, which is technically called the external auditory or external acoustic meatus. Behind that, we see the very large mastoid process, and then the small skinny styloid process. We rotate to the bottom of the skull, where we can now see other features of the temporal bone. If we look between the mastoid process and the styloid process, we can see the stylomastoid foramen, the small hole in the valley between these. We can also see the mandibular fossa, which receives the mandibular condyle and functions as the pivot point of the jaw. Rotating towards the back of the skull, we have the occipital bone, which you can see on the back of the skull. The most conspicuous feature of the occipital bone is this bump, the external occipital protuberance. The occipital bone connects to the parietal bones via this upside-down V-shaped lambdoid suture. On the bottom of the skull, we stay with the occipital bone, and we can see the very conspicuous foramen magnum, and on either side we can see the occipital condyles. Going now to the face of the skull, we can see the nasal bones, which form the piece of nose right here. As we go into the orbital or eye socket, we can see the lacrimal bone, this small sliver of bone. The indent in the lacrimal bone is the lacrimal fossa. Looking deeper into the orbit, we can see this nice rectangular shape here, and this is the lateral mass of the ethmoid bone. Carrying down the face, we can see the zygomatic bones, or cheekbones. The zygomatic bones have the temporal process, which extends back, to collectively form the zygomatic arch. Coming forward to the face again, we have the maxillary bone, which forms the upper portion of the jaw. Within the nose, we can see at the bottom the vomer, which forms the septum or vertical line of the nose. The vertical line at the top of the nose that we see is the perpendicular plate of the ethmoid bone. On the sides of the nose, we can see pairs of curlicues. The top pair is called the medial nasal concha and is part of the ethmoid bone. The bottom pair is the inferior nasal concha and is actually a bone of its own. Looking back inside the eye socket, we can see three features. The large slash running down and in is the superior orbital fissure. The large slash running down and out is the inferior orbital fissure, and the small hole in the very back corner of the eye is the orbital foramen. Going to the bottom of the skull to pick up some more features, we see now the roof of the maxilla. This is the palatine plate of the maxilla, with the incisive fossa showing up as this small indent behind the front two teeth. If we could remove a tooth, the socket would be called an alveoli. We carry back further down, and we now get to the palatine bone itself. The portion of the palatine bone that forms the back of the hard palate is called the horizontal plate, and if we look up the nose hole, we see the perpendicular plate in the middle, and the two vertical lines on either side are the vertical plates of the palatine bone. Bordering the vertical plates of the palatine bone, we see the pterygoid processes, these two conspicuous features that we can see running up at the back of the mouth. I need to rotate back to the face because I forgot the infraorbital foramen, the small holes beneath the eye socket that we find in the maxilla. Rotating back to the bottom of the skull, we go back and we can see two kidney bean shaped holes. I'm not sure if my angle is great, but we can see kidney bean shaped holes, and those are the jugular foramen. Immediately in front of the jugular foramen are holes that look like they were made by mechanical pencils, and those are the optic canals. We carry forward a little bit and we can see here and here the foramen lacerum. Just outside the foramen lacerum, we can see the foramen ovale, and we can also make out the foramen spinosum, just below the foramen ovale. We're now going to go inside the cranium of the skull. I'm going to remove the top of the skull, which is also called the calvaria, and we can now see the cranial floor. The cranial floor of the skull is divided into three primary regions: the anterior cranial fossa, the middle cranial fossa, and the posterior cranial fossa are the three major regions that we can see inside the skull. If we begin at the front of the inside of the skull, this arrowhead shape that we see delineated is the ethmoid bone. In the very middle is a ridge of bone called the crista galli. The plate of bone on either side of the crista galli is called the cribriform plate, and it's perforated by a number of small holes called the olfactory foramina. Behind the ethmoid bone, we encounter the sphenoid bone, which is collectively all of the bone that we see here. The top part up here is the lesser wing, and the two portions that we see down here are the greater wings. In the middle, we have this indent and what I described as the handle, which functions as the sella turcica. On either side of the handle, we can once again see the foramen lacerum, those jagged holes we saw on the bottom. As we go out from there, we see the foramen ovale, and just behind the foramen ovale, we see the foramen spinosum. If we look forward along the inside of the skull, in front of the foramen ovales by about ½ inch, we can make out the foramen rotundums a little further up along the way. We now go into the posterior cranial fossa. The most conspicuous features, of course, our very large foramen magnum or hole. As you work our way up from the foramen magnum, we have the hypoglossal canal, this small hole that we see here, our familiar kidney bean-shaped jugular foramen, and finally, at the top of the wall, the internal acoustic meatus. Coming out from our kidney bean-shaped jugular foramen is an indent or riverbed, and that will be the jugular fossa. Now, staying with the skull, we also have the mandible features to go through. If we look at the mandible, which we see here, it's made up of the body, which is the large U-shaped portion of the mandible, and the ramus, this large extension that comes up. At the top of the ramus, we find the mandibular condyle, the projection at the back that functions as the pivot point and pivots in the mandibular fossa, and we see the coronoid process in front. Working our way down along the ramus, we can see the angle, the back corner of the mandible. As we work our way forward in the mandible, we encounter the mental foramen, the small holes on either side of the chin, and there's the mandibular symphysis, this sort of imaginary line that we can see on the front of the jaw. If we could remove a tooth on our mandible, we'd encounter an alveoli, and as I go on the inside of my ramus, I can now see the mandibular foramen as this small hole here, and we'll end the skull there.